Surgical management of hypospadias, a congenital condition where the urethral opening is located on the underside of the penis, involves various techniques depending on the severity, location of the urethral meatus, and associated anomalies. The procedures aim to restore normal anatomy and function, including straightening the penis, orthoplasty, and creating a functional and cosmetically acceptable urethra, urethroplasty. Here are the key surgical techniques. 1. Meatal advancement and granuloplasty, MAG, used for distal hypospadias with minimal chordee. The meatus is advanced to the tip of the glans and reshaped. 2. Snodgrass technique, tubularized incised plate urethroplasty. TIP, one of the most common methods for distal or midshaft hypospadias. The urethral plate is incised in the midline to create a neourethra, associated with high success rates. 3. Onlay island flap, used for proximal hypospadias or when the urethral plate is not suitable for tubularization. A flap from the foreskin or other tissues is laid over the urethral plate. 4. Two-stage repair, indicated for severe proximal hypospadias or when there is significant chordee. Stage 1, straightening of the penis and preparation of the urethral plate. Stage 2, construction of the urethra. 5. Ducket procedure, transverse preputial island flap, used for proximal or complex hypospadias. Involves harvesting a transverse flap from the inner foreskin to form the urethra. 6. Koyanagi technique, a single-stage repair for severe hypospadias. Involves extensive reconstruction of the urethra and glans. 7. Dartus flap or tunica vaginalis flap, a technique for additional tissue coverage to reduce fistula formation, used in combination with other procedures. 8. Buccal mucosa graft, for cases where local tissue is insufficient. A graft is harvested from the inner cheek to form the neourethra. 9. Chordee repair, orthoplasty, straightening of the penile shaft, often required in proximal hypospadias. May involve excision of fibrotic tissue or dorsal plication. 10. Hypospadias repair with preputial reconstruction. Involves creating a new foreskin if desired by the patient or parents. Often done alongside urethroplasty. Considerations. Timing. Surgery is typically performed between 6 and 18 months of age. Goals, functional and cosmetic outcomes, with minimized complications like fistula, stricture, or recurrent chordee. Multi-stage versus single-stage repair depends on the severity and surgeon's expertise. Close follow-up is essential to monitor for complications and ensure successful outcomes.